Hello, folks. Welcome and thank you for joining us today. I'm Saul Weingart. I'm the president of Rhode Island Hospital, and I'm joined by several colleagues who I'll introduce in just a minute. We're here today to talk about how helpful and grateful we are for the assistance of the U.S. military in helping to support our operations at the hospital during this fourth surge in the COVID pandemic. I'm accompanied by Cindy Danner, who's our Chief Nursing Officer, Dr. Dean Roy, who's our Chief Medical Officer, Janine Peterson, who's our Nursing Director for Inpatient Critical Care. I have Captain Law, who's with me, Lieutenant Colonel Ramirez, and Colonel Masseri. Several of these folks will be speaking later, and we'll be taking your questions in a little while. I have a couple just general comments to make before I turn it over to Lieutenant Colonel Ramirez. I think, as you know, Rhode Island has been hit particularly hard by the Omicron surge in this pandemic. It's been extraordinarily challenging for us to deliver the care that we want to deliver to the people of Rhode Island and southern Massachusetts and beyond, who we serve as part of our mission. The challenges have been an upsurge in the number of patients who've been in the hospital with COVID-19. We've seen an 800% increase compared to early November. This has challenged our staffing and our ability to staff beds, in part because our staff have also acquired infections, and that's reduced our ability to staff beds. We've had as many as 100 beds out of circulation because of the staffing challenges. We've made a number of accommodations to try to address that, including combining units and closing many of our elective procedures. Many of our urgent procedures are deferred. We've repurposed staff in order to be able to support the care of inpatients who need us and to try to receive as many transfers from the community as we can so that we can deliver the extraordinary care that we're used to delivering for the patients who need us. We were fortunate to have been selected by the federal government. My understanding is this was something that was decided at the highest level of the government with the assistance and support of the Rhode Island state leadership in Washington and in Providence. And we were very, very fortunate to receive a contingent of 23 military personnel who we have deployed to a variety of units to help us through this surge. We have deployed this personnel to the intensive care units, to the medical surgical units, and to the emergency department. The orientation occurred last Thursday and Friday, and on Saturday we began the deployment for a 30-day mission with the possibility of a renewal that we have not yet clarified whether that will happen. But this 30-day mission is incredibly important to us because we are just past the peak in the surge, and our numbers are beginning to decline. So this is exactly the right time when our staff needed the help. There's been a significant emotional lift for having these capable clinicians working with us and helping us to care for the patients we care for. We've been able to expand our ICU capacity by several beds, which has been enormously helpful. And just overall, it's been a wonderful, wonderful opportunity to welcome these very competent, skilled, and capable military health professionals to help us through this very difficult time.